Brought to you by Chemistry.
Hello and welcome back to Brought to you by Chemistry. In the last episode, we spoke with Dr. Audrey Denazelle about environmental and health policies around air quality and how city planning can help change citizens' behaviours, creating healthier air and people. Well, today we're going to be looking closely at policies such as ULEZ to learn firsthand how they can directly impact our health, well-being and economy. Time to bring in our first guest, Deputy Mayor of London, Shirley Rodrigues. So I suppose my first little question would be, very briefly, could you explain sort of what the ultra-low emission zone actually is and what it hopes to achieve?
Yeah, sure. So the ultra-low emission zone is a clean air zone. And in London, and there are a number of clean air zones around the country, we set certain standards for vehicles, Euro 4 for petrol, Euro 6 for diesel. And vehicles need to meet that standard to be able to drive now in the whole of London. We've just recently expanded the ultra low emission zone to all of London in August, the 29th of August. If you don't meet those standards, then you have to pay £12.50 to drive in every day that you use that vehicle because it's non-compliant. And if you don't pay the charge, then there is a fine. So it's £180 reduced to £90 if you pay it within a certain time. And the idea is that it's to get people thinking about their car use. We have lots of older polluting vehicles, and we know how much they contribute to lots of impacts, health impacts, from asthma through to dementia, through to heart disease. And increasingly, we're seeing evidence, health evidence, about how it affects the whole life course from even before birth all the way through to old age.
Okay, and so, the ultra-low emission zone was more concentrated within central London. And so why now, sort of in this year, 2023, has it been expanded further out?
The evidence, as I've said, is every day we're getting more and more health evidence. So the WHO, for example, has updated its health-based guidelines on air pollution and applying that to London. There is nowhere in London that meets those health-based guidelines. So whilst we have some legal limits, the Mayor doesn't believe that is sufficient to protect the health of Londoners. So we wanted to implement a number of policies. So the ultra low emission zone is one of a number of policies that the Mayor has been doing, from cleaning up our buses, incentivising the uses of zero emission capable taxis, electric vehicle charging. Of course, our big one is moving more people onto active and public transportation. The target for that is 80% of all trips by 2041. So all of these things, together with what we do on planning and so on, are a sort of suite of proposals and activities that we undertake to try and improve our air quality in London. The ultra low emission zone is just one of those. So I should say, we started out with the toxicity charge, which is when the Mayor first started talking about taking this forward. So in 2017, we introduced a £10 additional charge to people driving in the congestion charge zone as a sort of precursor to what we were doing. And then in 2019, we introduced the Central London zone. 21, we expanded it to Inner London, and then 23, early this year, we expanded it to Outer London. And that's because the evidence showed that the transformation we were seeing within Central and Inner, there were still very many people who are exposed to air pollution in Outer London, 5 million people who weren't experiencing the benefit of the central and inner zones. We had evidence from the Asthma and Lung UK organisation, for example, about the impact on older people was much more prevalent in Outer London, more GPs visits and so on, asthma emissions, etc. So lots of evidence from lots of sources. So the Mayor wanted to make sure that people living in Outer London were benefiting just as much as people in Inner London. As I've said, the impacts on health are so severe, but we had to take action.
Look, London is huge, and the mayoral office doesn't just control everything and can do everything at the same time. You have to work with all the different London boroughs. So how does it work? How does something like ULEZ or air quality policies more in general How does it work, and how do you sort of drip them down and get all the London boroughs singing from the same hymn sheet?
Well, first of all, you're right. The governance in London is very dissipated. So similarly with waste management, for example, and that's a bit of a legacy from abolition of the GLC for those of your listeners and viewers who might remember that.
I really like that you've put in a political term the fact that when I moved from Croydon to somewhere else, that the bins were on a different day, and it really annoyed me.
Yeah. And unfortunately, the mayor doesn't have the ability to control that. So a lot of what the mayor does is sets the vision and some objectives for London, but then who delivers them will depend, so it could be the local authorities, it could be housing associations, it could be, health authorities and so on. So the mayor doesn't have the ability to direct those organisations, but what he does is works in partnership with them and tries to set that standard, tries to convene organisations in order to try and move everybody forward in London to meet his very big objectives for example, for London to be a net zero carbon city by 2030 rather than the UK government level of 2050 and so on. But in terms of air pollution, we do have some very limited powers. So the air quality strategy is set by government, and the Department for Environment, Food and Rural Affairs is sort of legally responsible for making sure the legal limits that are set by government aren't exceeded in England. And they do a lot of things like sort of coordinating air quality assessments and action plans, and they're the ones that would set, for example, for those areas where air quality isn't within legal limits or doesn't look like it will be, then sort of what policies could those areas implement. And that's sort of the genesis of the clean air zones, where a number of authorities were mandated to take action. London wasn't, because the mayor had already decided that we wanted to implement and bring forward basically the clean air zone, our equivalent with the ultra low emission zone, and that was brought in 2019. And the mayor is then able to say, okay, we've got the standards for England, the air quality standards, we've got legal limits and objectives that the government have set in the air quality strategy. But as mayor, I don't think that's right for London. So I want to go further and faster. And that's what he did. So in our environment strategy, his environment strategy in 2018, we said that we wanted to meet the WHO, World Health Organization, health-based guidelines. We wanted to work towards them to meet them by 2030. More recently, the government has just amended its air quality strategy to reflect the WHO guidelines, but to a different date, but not by 2030, by 2035. So again, sort of delaying action. And I don't know if you'll remember again that many of the sort of EU limits that were set in our law, in our legislation, the then government applied for a derogation, sort of condemning a generation to poor air quality, and of course all the health impacts associated with that. So the mayor, having set his objectives, and we got this air quality strategy, we were able to then to set for London a sort of framework of activity that the boroughs would then need to sort of meet. So they're required basically to look at review what the air quality is like in their area, where it's not great, then to declare air quality action zones, and report annually really on their pollution levels and what actions they're taking to reduce emissions. And through that guidance that we offer, we try and sort of get them to do more public transport, more walking, more work on non-transport related pollution, and we also provide some funding, not a huge amount because the mayor doesn't have a huge amount of funding, but we have, for example, a mayor's air quality fund which they can bid for. That's the general approach, but largely it's about trying to encourage, incentivize, convene local authorities to work together. And the mayor has been very clear, we cannot tackle many of the problems we face in London alone. We have to do that in partnership, and many of those local authorities or many other organisations are very keen to take action, are often very progressive and moving ahead. So and it's more about trying to get every borough to take action, so there's a bit more consistency.
So in terms of the ULEZ scheme, as part of it, there's a scrappage program where if you qualify for it and your car isn't doesn't meet standards, you can get up to £2,000, or you can get a travel card as well, and all of these things. So with doing something like that, is that something that you thought, hey, this is going to really help people transition away from high polluting vehicles?
Absolutely. I think, when we're, whether it's the ultra low emission zone or in fact any other policy that the Mayor brings in, we look at, in designing the policy, what the impacts will be on people in London or businesses, and understand what, in designing the policy, what might help mitigate certain impacts. And whether that's, for example, for the ultra low emission zone, we introduced a number of exemptions, so for people with disabilities out to 2027, or charities as well. But we also thought, that people will need some help. So we've been arguing with government, lobbying government indeed, to implement a national scrappage scheme. And indeed, the government provides funding for many of the clean air zone cities around the country, but has refused to do that for London, which is, we think, hugely unfair. Londoners pay almost about half a billion, of vehicle excise duty that goes into the sort of national coffers, but we don't get any of that back to help people with scrappage. But the Mayor decided that he wanted to help people, so he set up a scrappage scheme, which was initially targeted at the most vulnerable. So again, people with disabilities, charities, and so on. And then when those priority groups, had had it long enough, I think, to apply, we then opened that up more recently to every Londoner. So now every Londoner is able, with a non-compliant vehicle, is able to apply for that scrappage for £2,000 to replace a car, and £1,000 for a motorbike. And he topped that funding up, so it's £160 million that the Mayor has provided to help do that. And it's been hugely popular, and people don't have to then, could take scrappage, or they can take a sort of combination of scrappage funding and getting a bus and tram ticket, an annual bus and tram ticket. So there are lots of different things that people can do. We offer funding to help people retrofit their vans, for example. So rather than scrap a van, if we're able to retrofit it so that they could extend the life of it, but it's a cleaner vehicle, then we also do that. So lots of different mitigations that we've offered, and it's absolutely critical that you help people as far as you can to make the change. But people generally want to do the right thing, and the ultra low emission zone, for however people might think it's been contentious, actually the polling has always showed that people want to do the right thing, want to improve air quality for their health of themselves, their family, their friends, their neighbours.
Yeah, my wife and I now have a ULEZ day. So when we know we have to pay £12.50, we go, all right, we need to do everything on one day. That means you're going to Homebase, Wix, you're going to the shops, you're going to Boots, everything you do in one day. And
I think there is an advert for
and we think like, oh yeah, we've gamed the system. And then I sort of realized that's the point. The point is to have people work more efficiently and to work in a way that prevents more and more pollution. Excellent. And so you mentioned earlier that you have some data for me. I'm a person that loves data. Hit me with the data.
Well, this is very timely. So we've just published a report, just sort of compiling some data after 1 month's operation of the expansion of the ultra low emission zone in August 23, and that's showed that we've seen compliance, which is essentially the number of vehicles seen driving on an average day in the zone, so in London, but also we've got data for outer London, and that's shown a jump from 85% compliance in outer London when the Mayor first announced that he was consulting on the ULEZ expansion in May 22, to 95% now. So a huge 10 percentage point increase, which is absolutely fantastic. And essentially what that means is the outer London vehicle compliance rates have nearly caught up with inner London, so bringing cleaner air to 5 million more Londoners. We've had about 37,000 Londoners and London's businesses and charities that have benefited from our scrappage scheme. So, millions of pounds. I was talking about the 160 million pound scrappage scheme. So, a lot of that has already gone out. There's still lots available. So anybody who hasn't taken up the offer, please do check if you've got a non-compliant vehicle. This is going to bring cleaner air, as I've said, to 5 million more Londoners. We don't have the data for that yet because we'll need essentially 6 to a year's worth of data so that we can properly talk about the air pollution impacts. And this is what we did when we reported on the central and inner London ultra-low emission zones. It takes time. You've got to take account of the weather, seasonality of the weather, and so on, so that we're absolutely clear about that. But we know that if it's anything like the impact that it had on the central and inner London zones, that this will lead to much cleaner air. We saw, levels of the sort of the most dangerous pollutants, PM and 2.5 and NOx, cut by almost a half in central London and around a fifth in inner London. So, we still have a long way to go, but we're really hopeful that the sort of modelled impacts that we expect to happen are going to happen, but we'll be able to report on that, as I said, in about 6 months to a year's time.
Okay, I'm excited. I'm going to see it. I'm going to read it. I'm going to, yes, more data. This is going well, hopefully.
Yeah.
And so, in terms of like moving things forward now, are you optimistic? Like, honestly, not as you as deputy mayor, you, Shirley, as an individual, a Londoner, are you optimistic?
Am I optimistic about the ultra-low emission zone and the impacts of that? Absolutely. We've seen the evidence from central and inner London. This is one of the most effective clean air measures. We've had scientists say, I think it was Dr. Gary Fuller of Imperial College saying that he's not seen an initiative like this in terms of its impact and, globally. We've got lots of mayors from other cities looking on to see what we're doing in London because they want to emulate the same thing for their cities. Maybe all of them have different starting points and will have different powers, so they may not do it in the same way as we do in London. But that idea of cleaning up London's air using charging mechanisms or accompanied by various things like more public transport and active transport and electrification are really seen as essential by many mayors around the world, and we're not going to meet our air quality targets or in fact our net zero targets, I think, without doing some of the things that we're doing. So yeah, hugely optimistic about the ultra low emission zone. And anecdotally, lots of people say, it does feel the air is cleaner in London, but the evidence is being collated all the time by academics and others that will point to that clean air impact and I think impact on health as well. And that's what I'm most excited about. Am I optimistic about what we can do generally on air pollution? I think absolutely. If you have the leadership and if you have the will, as we have done with the mayor in London, Sadiq Khan, then you can really drive forward and lots of people are looking for that leadership. And I think we've shown in London what can be done if you just push ahead, and it does make a difference very quickly. We still have a lot to do. We've got to do more work on non-transport related emissions where we have very little powers, and so we do rely on government. We have to do more work on indoor air pollution, which is something that the Chief Medical Officer highlighted in his recent report. And again, this is something, both of those areas are things that we've highlighted in the Mayor's environment strategy. But obviously you start with where you have the powers and the ability to take action, which is what we've done on transport emissions and had huge success. So now our attention turns to other things as well. Am I optimistic about what we could do? Yes. Do I think we're able to make as much progress as we have done on the ultra low emission zone? That's a difficult question to answer, because obviously we've been saying to government, you need to give us the powers, you need to give us the funding, not just us, but cities around, local authorities around the country. You've really got to take this seriously, and we haven't really seen that that leadership from our government, which is is scandalous, I think, because we know how bad it affects people, and we know this is something that can be resolved. These are lifelong illnesses that people get. Sadiq, why Sadiq really took this as a key priority for him is because he was training for a marathon and developed adult onset asthma. He didn't realize that was because of our air pollution. Now he has that as a lifelong condition. You'll have heard the story of and the terrible case of Ella Roberta Kissi-Debrah, who is the first person to have got air pollution on her death certificate, again, because of the terrible air pollution on the South Circular. These are all things that can be prevented if you clean up our air, and we have the solutions, and it's really about having the will and the leadership to tackle them. So I am optimistic. If it was in our gift to get on with it, I think we would do, but it isn't. So we do rely on others, government particularly, to help. Slightly less optimistic about that, but who knows with the changing government.
Hello, everyone. My name is Rosamund Adoo Kissi-Debrah. I am the WHO Breathe Life Ambassador. I'm also a founder and director of the Ella Roberta Foundation, which was set up after my late daughter died from a very severe asthma attack. And I have various roles, like I'm the honorary president of BISA, Indoor Healthy Buildings.
So for you, I mean, you've lived in Lewisham for such a long time. Is it?
I came here in 2000.
So 2000 till now, 2023. I mean, for you, how would you say air quality's changed since then?
I think air quality in general has got better. Let's talk facts now. We've phased out coal I don't know whether all coal's phased out, so I better be careful. But coal has been phased out, and there have been some initiatives brought in, starting with Ken Livingstone. So things have got better. However, now this is where it comes in. It hasn't got better to the point that it does not impact human health. I wish it did, actually, because then you and I wouldn't have to have this awful conversation. Let's start with before the pandemic. The waiting list was at between 4.6 and 4.9 million, depending on who you talk to. And that was even before the pandemic. And it's now 7.75. And the pandemic was 3 years ago. So, and it was always heading upwards anyway. So yes, the pandemic added some, of course, but not as much as, when people blame everything. Look, the figures were going in the wrong place anyway. The research in air pollution over the last 10 years, I think there's more research in the last 10 years than way before then. So we know far more now. We know that it impacts every organ in the body. So every non-communal disease is linked to air pollution. So Parkinson's, everything. When I list it from top to bottom, like strokes, cardiovascular, respiratory illnesses, low sperm count, miscarriages, stillbirth. Now, even more worrying, dementia, cognitive decline. They found black carbon on the brain. So very similar to, and I think what we need to be really concerned about Alex, is the same black carbon they found on the brain of dementia patients. They found that in the placenta of pregnant women. So let's just take a pause and think about that. So that means air pollution literally affects us from the cradle all the way to the grave. And what I'm trying to talk about is, no, not everyone's going to drop dead, but I'm talking about premature deaths. And also, you have to then factor in who is most impacted by air pollution. So we know the sources come from emissions, wood burning, construction, dust. So let's have a look at where we live, the country. Oh, sorry, and I apologize. Rural ammonia. So just to add on to, but let's go for urban air pollution. We know it's when you live near the main roads. Because someone wrote to me something every now and then. When someone writes me the most ridiculous thing, I then go back to many conversations my late father and I had. My late father was, a highly intelligent man. He ran for elections even in Ghana. My father was steeply into politics, Mr. Kissi-Debrah. And Dad used to, every now and then, when I used to get frustrated at things, he always used to say, remember, not everyone is on your level. When I used to get, like, what don't they see, Dad? Because I don't suffer fools gladly. So someone wrote to me on Twitter, as they do, another troller, are you trying to say the air pollution is racist now? That's what I got. No, that's what I got. And I thought, so I remember when I met Chris Whitty and we were talking about this, those who were adversely impacted. And it was really comforting the following day to wake up to a headline of Chris Whitty addressing this issue. Because when I say it, apparently it's a problem. But hopefully when the CMO says it, then the other thing people need to understand is if you speak to, and look, I am from London, but speak to most GPs in London and talk to them about non-communal diseases and who does it impact most? This isn't, inequalities in health. When I was doing my master's in 96, I knew about it then. It is nothing new. Forget all this culture war nonsense. There is so much research to do with inequalities of it is nothing new. If you're poorer, you tend to live near a main road, social housing. That's where all the shops are. If you live, on top of a Chinese, when they cook, you're going to be inhaling. This is nothing new. Just because the politicians have decided to weaponize air pollution, it has now become part of this culture war.
This year we've had the ultra low emission zone that has expanded, from more central London to basically the entirety of Greater London.
Not correct. No.
Correct. Let me say my question, and then you can come in and say how I'm wrong. I speak for the everyman here.
Oh, okay.
So, ultra low emission zone has been expanded from sort of more central London to the entirety of Greater London.
Okay.
What are your thoughts on this?
When we went for a second inquest, the British public wrote to the Attorney General to support us for the inquest. And also you may know or not know that it is not every inquest that has a prevention of future death report. But Ella's one was so significant, there was one in there because the coroner felt we needed to learn, otherwise more people would die. Right. During the inquest, there was not one expert, not one, on either side. So the parties in the inquest were the government, the Mayor of London's office, not the Mayor of London, his office. Sadiq Khan was not the mayor when my daughter died. I don't know how many times I need to repeat that. And the other party was Lewisham Borough, who, due to a technicality, and I can say this, they were not in charge of air quality when my daughter died. So no matter what the outcome was, they weren't going to be held responsible. If Ella died for today, it would be a different matter because they are responsible. So these were the three parties. Now, everybody, the government's experts, everyone's experts. One of the things they all agreed, and I saw I've seen the recommendations to the coroner, was that the ultra low emission zone should be expanded by the Mayor of London. Forget about the deficit or whatever, from a health point of view. So and it is no secret that I have a good relationship with the mayor. So initially in October 2021, exactly 2 years ago, it was because were the twins on half term? I can't remember. But we went, he came to their school. So they were not on half term because he came to their school. It was expanded from central London to the north and south circular. I have to admit to you, and I'm going to say this for the first time, I never swear, but I was pissed. Because what that meant is the south circular that ultimately killed Ella was not included. This is the bit that people still don't get. It was not included. So this latest expansion finally included the South Circular. My point to Sadiq was, I can't believe, and you can see where I'm coming from, I can't believe you've just extended it just up to the North and South Circular. We're still being impacted. Then he said to me, he was like, well, I can't just expand it, because when people voted for it, whenever that was, it was to up to the North and South Circular. And I was like, but Sadiq, you have a court who has told you to expand it. Now you can see where I'm coming from. So just expand it. And he's like, seriously, I won't say we fell out, because we never fall out. We have
please, you come on my podcast. I'm a simple boy, and you've come on my podcast being like, me and the mayor of London, we're on first name basis. Yeah, we had a falling out. Like, he's your classmate. Like, so no, continue. I can.
So, but what he said to me, look, there has to be these consultations, there have to be, and I know deep down he's right, but because I so wanted it to expand, especially to include the North and South Circular, I kind of felt he could go to Londoners and say, look, there was an inquest, this is what I was told, that's why I'm doing it. I thought that was going to be enough, but he told me that's not going to be enough. So I wasn't going to let it go. So when he expanded it, I think, and he said that on his podcast somewhere, and I think he was on James O'Brien, and I think I rang up, and Sadiq said he was after me going, yeah, well done, Mayor. Nah, I just wasn't feeling it, Alex. I was a bit like, how can you only extend it up to the South Circular? I have to admit, North London, I wasn't even looking at that, because Ella's thing was about the South Circular. How can you not include it? And even he admitted that he thought I was going to ring him and say, well done, you've extended it. And that wasn't the case. And I do admit it. I wasn't going to let go, because what I did tell him, and it will come out very soon, is remember the previous mayor. He should have done this and he didn't do it. And it cost my daughter her life. And I know politically, it's probably not the greatest thing, Sadiq. I know for you. However, I said to him, I know you. And I know if you were to leave office and you don't do it, no one's probably going to have the courage to actually do it. And the fact that I know your team, i.e. legal team, have briefed you, ultimately, even in outer London, the data is showing their health impacts are actually worse than inner London. And I think you will regret it if you don't do it. I said, politically, I have to admit, I didn't think it would be as bad as this. The reason why I stick to the ULEZ, because lower emission zones, they are all over the world, all over Europe especially. Lowering emissions, fossil fuels, if someone can give me another way to lower them, then fair enough. But at the moment, I haven't seen any.
Thanks for joining us for this episode of Brought to You by Chemistry with me, Dr. Alex Lathbridge. Join us next time, where we're going to be exploring the links between air quality and wildfires. I've been told to say that the conversation gets heated, but I'll let you be the judge of that. See you next time.